James Evans.
Thank you, Deputy Presiding Officer. I'll begin, as always, by placing on the record my thanks to NHS and social care staff across Wales, doctors, nurses, paramedics and care workers, and the support staff have once again carried the NHS through one of the most pressurised months and periods of the year. But gratitude alone cannot compensate for a system that has repeatedly pushed beyond safe limits. The Cabinet Secretary described services this winter as broadly resilient and tells us that essential services have been maintained. Yet for patients across Wales, the lived experience this winter has been one of overcrowded emergency departments, ambulances outside hospitals and waiting lists that have continued to grow. When resilience is claimed so confidently, is it reasonable to ask whether the description reflects the operational reality or simply the absence of a complete system failure? According to the latest statistics from Stat Wales, NHS performance reports for December in 2025, over 28% of patients tended A&E waited more than 4 hours. And I was recently in Prince Charles where someone was asked to wait up to 8 hours and someone had been there over 12 hours. So I'm not quite sure where we're getting waiting list time data from. Category A ambulance response times, they are 9 minutes and 43 seconds, missing the government's own 8-minute target, and more than 750,000 people remain on an NHS waiting list, and bed occupancy has remained close to 95%, well above the 85% threshold identified by the Royal College of Emergency Medicine at the point at which safe and elective care begins to break down. Cabinet Secretary, if these figures represent resilience, then what do you consider to be system failure? And how much further must performance deteriorate before that description changes? You tell us that winter planning began last March and that lessons were learned from the winter of 2024-25, yet the same pressures reappear with remarkable consistency. Delayed discharges, escalation areas becoming routine, and staff stretched to breaking point. If planning is generally improved, why do frontline pressures still peak at unsafe levels every single January? The statement places significant emphasis on short-term winter sprint measures, including a pre-Christmas discharge push and a further sprint planned later this month. These initiatives may improve flow temporarily, but they also raise a deep concern. Why has the NHS in Wales become so reliant on repeated emergency sprints just to cope with predictable winter demand? And how do you, Cabinet Secretary, intend to move the system away from this start-stop model towards genuine year-round resilience? And do you think this model is stopping transformation of the service? Despite repeated commitments on recruitment and retention, staffing gaps remain severe. The Royal College of Nursing in Wales reported in December last year that more than 2,000 nursing posts across Wales remain vacant, with rising resilience on agency staff as a consequence. Staff shortages are acknowledged in the government's own statement, but when will we see measurable reductions in vacancy rates rather than continued reliance on goodwill just to bridge the gap in a missing service? Primary care, which should be the first defence against rising hospital demand, is also under huge strain. Nearly half of GP practices in Wales have closed their lists or reduced access, citing workload pressures, funding constraints or GP burnout. How can hospitals ever operate safely when access to primary care continues to shrink? And where in this statement is the plan to restore capacity rather than simply managing the fallout? A turn to hospital flow. In turn, this cannot be fixed without social care capacity. The WLGA has repeatedly warned of deepening workforce challenges across dom care and residential care, directly contributing to delayed discharges and blocked beds. The government highlights short-term improvements in discharge activity before Christmas. But Cabinet Secretary, what is being done to stabilise the social care workforce so that these gains do not evaporate once short-term funding ends across Wales? Infrastructure also remains another long-term weakness across Wales. We continue to receive lower per head capital investment than hospital estates in other UK nations, leaving staff working in outdated buildings ill-suited to modern clinical demand and infection control. So when will the Welsh Government bring forward a long-term capital strategy that matches future demand rather than relying on temporary fixes in ageing estates across Wales? And finally, there is the issue of accountability. Despite repeated winter crises, performance continues to be described as resilient. But resilience should be met with the ability to absorb pressure without harm, not the normalisation of unsafe delays, corridor care and exhausted staff. At what point does a Cabinet Secretary accept that managing decline is not the same as delivering recovery? Cabinet Secretary, this statement will go some way to reassuring people across Wales, but I know what most people are saying out there, that people of Wales deserve better, more than warm words and emergency measures. They deserve ambition, honesty and a clear route to recovery within the NHS in Wales.
I agree the people of Wales are entitled to honesty. I'm going to take the opportunity of correcting some points the member made in his questions. Whilst it is correct to say that demand is up to very high levels in certain parts of the system, it is not correct to say that there are more ambulance waiting outside hospitals this year than last year. In fact, there's been considerably fewer. And that matters a lot because people are spending less time in the back of an ambulance and are being admitted more quickly. And those ambulances are available to transport other people to hospital. That has not been without its challenges, but that is absolutely the state of affairs on the ground, and that is positive from patients' point of view. It's still far too high, but it's markedly less than it was last year, and I'm sure he'd want to welcome that when he has an opportunity to put the record straight. He also made the point that waiting lists are going up. Waiting lists are in fact going down. We've published data which shows you they're going down. It's really important that when we have these exchanges, they're premised on the facts and the data. And I think that is important to put this issue, serious issue, in context. He made a very important point about bed occupancy in hospitals. He is correct to say that the levels of occupancy are above where we want that to be in the system. He's also correct to say that obviously causes challenges in terms of flow through other parts of the hospital. I have been pleased to see at parts of the festive period, not consistently, but there has been evidence of a reduction in corridor care. It hasn't been maintained, but there have been times when that has been reducing, and I think that is a positive sign for work that can be, as he says quite rightly, continuous throughout the year. I don't think it's fair to say that the system is dependent on stop-start interventions. This is the first time we've had a second sprint. It's quite difficult to do a second sprint because of the resource allocation that goes with the first sprint. But the truth is it has meant there's more capacity in the system. It has taught all parts of the system that by behaving in certain ways, we can get patients flowing through the hospital safely more quickly. There can be fewer people waiting in corridors, and we can discharge people more quickly before midday. All of the things that we want to see, all of the things important to make sure the system comes back into balance. Finally, he made two important points. One, in relation to staffing. There has been a very creative approach to redeploying staff over the last few weeks in order to manage peaks of demand, but on a more sustainable basis, also deploy more senior clinical decision makers to emergency departments so that they can make decisions about discharge or admission in a more effective way, and I'm pleased to see that. Finally, I would echo the point he makes about the importance of the social care workforce. This government is committed to expanding and supporting the social care workforce, as he will know. I think the system has worked well together over, in very difficult context over the last few weeks. We've seen the number of delayed discharges reduced year on year. They're still too high, but we are seeing progress in the system. We want to see that continue.